Hello, I'm Dr. Dennis McKenna. I'm joined today by Dr. Alan Boulos. Alan, it's great to see you.
Great to be back, thank you.
All right, very good. So Dr. Boulos is, of course, our chair of neurosurgery and currently serving as our interim dean in the college. So it's great to have you here today. Today is Thursday, March 10th, giving you the update from Albany Med. All right, Alan, we're going to do it like we normally do. We're going to start with some statistics. Let's pop open the first graph here. Cases in New York State with COVID. Visually, you can see what's happening here. It continues to go down. 1,394 in the state. It was almost 18,000 at its highest level.
It's great to see it trending this way.
Next graph, capital region, we're under 100, so we're currently at 99 there. Interestingly, new cases per day, which is really a predictor of what we're going to like 2 weeks from down the road. New cases per day that land in the hospital, we're currently at between 8 and 12 per day in the capital region, which has, let's call it 1 million people. So you're really talking about less than one new case per 100,000 that end up in the hospital each day. So that's wonderful news. All right, next graph here is admissions and discharges to the medical center. And as you can see, we're looking at about 2 or 3 cases that come into Albany Med per day. Obviously also coming down. Alan, we spoke about this last week. Percent positive. So that's if I'm tested, all comers, what's the likelihood of my test being positive? In the capital region 2 months ago, 3 months ago, that number was as high as 22%. In some of the counties of the capital region, it was as high as 30%. Now, in New York State, we're looking at 1.5%, and in the capital region, it's 2.6%. And because it's under 5, we made the changes that we talked about last week, including the masking being removed in non-clinical areas, as well as allowing more visitors on campus.
That's great news to see life kind of return back to normal.
For sure. Now, people ask, well, why is it that we still wear masks in clinical settings? That's still a CDC requirement, and obviously we'll follow that as long as that is a requirement. As a surgeon, as someone who cares for people who are in the hospital, talk a little bit about what it means to have family members be able to visit them.
So family members are critical to a patient's recovery. They not only provide the emotional support and the welcoming nature of being in the hospital with familiar faces, they also are strong advocates in the health system for their loved one. And so they are critical to the recovery of patients. And it's been great to get them back in through to the hospital at the tough hours, like early in the morning and the evening, times when it's traditionally been hard to get that support. They've been really helpful. For
sure. So now we're talking 10 a.m. to 8 p.m. You can have 2 visitors at a time. You can even swap those out, so 2 could come in and then 2 more could come in later. And obviously for certain extreme cases, compassionate exemption to allow even more people at the bedside. And once again, we thank our security folks for helping with that as well. All right, next graph, the morning census here at the medical center. Last week I predicted that we would be down into the 20s, and we are. So we're at 29. 28 adults and 1 pediatric currently in the hospital. So that number also continues to go down. All right, one more graph here, maybe 2 more. Which variant are we dealing with in the region? As that graph shows you, it's still 100% Omicron, which, as we've talked about in the past, less virulent, more transmissible. But that's still the strain we're dealing with.
Unfortunately, at this time, even that transmissibility is going down, right? We're seeing far fewer cases in the community and in the hospital.
Absolutely. All right, let's show one more graph. So this graph we call our red, blue, black graph, depending on the colors of the various lines. This shows vaccine effectiveness, and it compares those that are vaccinated with those that aren't and what the likelihood is that they will land in the hospital. Interestingly, if you look at those 2 populations and you look at the likelihood of getting the virus, the vaccine is about 73% protective against getting the virus. But if you look at the likelihood of preventing hospitalizations, that graph will show you it's closer to 91%.
Yeah, it's still very effective.
For sure, for sure. Okay, Alan, tomorrow, believe it or not, is the 2-year anniversary of the World Health Organization declaring COVID to be a worldwide pandemic. And I can recall those early days of incident command. You were there, of course, from the very beginning with us and all the things we did. There's a video which we will make available to our workforce to see, and we'll also put it out on social media tomorrow. That is a reflection on the last 2 years, and most importantly, of the incredible work that our workforce did. So I encourage you to check that out. It's a great video.
Incredible work and effort by many, many people.
Okay, very good. Changing gears, I've received a lot of emails. I'm going to guess you have as well. In fact, I know you have because you've sent them to me, from people at Albany Med, students, frontline care workers, everybody who say, we want to help out the situation in the Ukraine. We want to help out. We want, can we donate some medical supplies? Often individuals who reach out to us are part of volunteer organizations or missions that have that as a purpose. Interestingly, about a year or so ago, we put together a group because we know these requests come in, right? Hurricanes, floods, natural
People want to
disasters.
help.
They do want to help. And we have on our group someone from our supply chain, someone from our pharmacy, someone from our regulatory affairs, someone who helps represent us in the community, and someone who helps our relationship with other not-for-profits and government agencies to deal with these requests. And they're actually meeting tomorrow, and we've forwarded all this information to them. If you have an interest or if you have a connection, if you want to see about what's potential, reach out to John Regan, R-E-G-A-N. You'll find him in Outlook, and let him know. And we'll figure out a way to do this in an organized manner, because the number one thing we want to be sure is the supplies get to their intended purpose. And the other thing, Alan, which I think we were talking about earlier, is there's going to be what's called a Gathering for Peace, and that's going to be in Hike Auditorium next week. I think we heard Kathy Palazzi involved, Chaplain Marvel, a couple others, and obviously in person will be available, and we believe there will be a virtual option as well.
Yeah, it's important.
So a lot of people have wanted to do that. Let's talk about the college, right? We talk about this a lot. We are an academic medical center. 3 missions, right? Clinical care, education, research. Let's focus on education a little bit. I don't know about others out there. I have this great opportunity to do what's called a capstone lecture. I do it for 4th-year medical students, and I did a class today. And these are students who are going to be graduating soon. And so I have a chance to sort of see all of them at one point. And it is, let me just say this, the future is bright. The graduates of our medical school are very smart, and they're very engaged, and they ask great questions. And it was fun for me. But there's some other updates we want to give about the medical college. First of all, next week is Match Day. What is Match Day?
Match Day is when the graduating medical students find out where they're going the following year for their training. And so they'll rank the number of programs where they're in the discipline they want to go into, whether it's surgery or medicine. And they'll rank the programs 1 to whatever, and ultimately find out that day precisely where they're going. And so it's a very exciting day for the students, for their families, and for the school, because we're always excited to see our students match so well and be happy and proud about where they're going to be going to the following year.
So this is a really special event. As you mentioned, like in your case, you wanted to go into neurosurgery. You obviously became a nationally known neurosurgeon. You ranked the programs that you were interested in based on going there, interviewing with them, and those programs also rank the people they see, and a computer program puts it together. And at the same time, throughout the entire country, East Coast, West Coast, all open up envelopes and find out what they're going to do and where they're going to do it. It's a pretty remarkable day.
That's right.
It's exciting. So our students next week will find out, and obviously we'll report on that. We always do so very well. Some stay here, which is fabulous, and some go to other places. So wherever they go, we wish them well.
I stayed.
So did I, after some time in the military. All right, very good. And then, Alan, you also mentioned something about curriculum changes, and so you want to talk about that?
Yeah, so Dr. Ellen Cosgrove has run a fabulous team, and they've worked to reconfigure their medical school curriculum, which hasn't been changed since the early 1990s. And it's affording the students a little bit more time to do self-study and research, and compressing the basic science part, and also giving them earlier exposure to clinical medicine so that they have a longitudinal curriculum from the beginning all the way through the 4 years. Really fantastic changes, and it's really under her guidance and vision that we were able to get this through the accrediting body so quickly, and implementation begins this coming year with the next group of students.
A lot of great work, Dr. Cosgrove and others. Thank you so much. Obviously, curriculums change, and you don't want to be stagnant. You want to change with it, and this one is, obviously the most current possible curriculum we can have for our medical students.
Yeah, it's really forward-thinking.
Super, wonderful. All right, Alan, next week we're going to have the 24th Radiothon for what we call Care for Kids Radiothon. This is to raise money for the Bernard and Millie Duker Children's Hospital here at Albany Med, the only children's hospital in the region. We do this every year. It's the 24th. This is partnered with 2 local radio stations, so we're talking about 810 WGY, and also they're 103.1 on the FM dial. and 99.5 The River. And we're looking for volunteers. I've done this before. It's fun. You can answer the phone. My wife has done it. It's a great opportunity to talk to the community, and they want to support us. And so we need people to help out. So volunteers look for that. All right, very good. And then speaking of opportunities for our workforce, there's something called the American Red Cross Blood Battle. And Alan, you're a surgeon. I work in the emergency department. We know that, as a trauma center, as a hospital that does complex surgery, we need blood to take care of our patients, and there's an opportunity to give.
Yeah, so particularly this year, there's been a very severe blood shortage, and so more so than a typical year, for instance. And some of it is as we relate to trauma and surgery, but we also have very sick patients as it relates to chemotherapy drugs, and therefore need blood products to get their blood circulating at the right levels. And so all of that is dependent on community support and donations. And so this year is the inaugural blood battle, and it includes several of our local hospitals and insurances. MVP and CDPHP are involved. And it's March 18th. We have a big drive at the American Red Cross headquarters, 33 Everett Road. And it's a competition, so we want to be number one. We want as many Albany Med employees to donate, and it'll be a huge help to both the American Red Cross and then the Albany Med.
For sure. Fred and I talk about blood donation all the time. He donates whenever he can here. I do the same. And I always think about that. I always think, that could go into a neonate, that could go into a very little tiny baby, it can go into a trauma patient. There's so many needs, and our workforce is always so generous with their donation of blood. So look for that. That information is on the intranet. All right, last topic is our Daisy Award winner, right? We're always so proud of our nurses. These are nurses that have been recognized by family members or patients for really just singular acts of kindness. This month, we're going to recognize Catherine Dupuis. I worked with Catherine when she was in the emergency department, and now she's up on labor and delivery, and she's been there for many years. And as always, we ask Fred, and in this case, Dr. Boulos, to read the nice comments that somebody had about Catherine.
Yeah, so this patient, after being discharged, said this about Catherine. Catherine supported me through a difficult delivery. She was due to go home but stayed so I was comfortable. She held my hand and wiped my tears. Without her support, I don't think I could have done it. I am forever grateful. And it's those acts of kindness getting recognized, and it's an everyday event, fortunately, in the hospital, but it's great to see it get recognized and thanked.
Absolutely. So congratulations to Catherine, all the nurses up on labor and delivery who do such a great job, and the cinnamon buns, they're on their way.
Oh, yeah.
They're on their way. All right, this weekend is daylight savings. So spring ahead, fall back. So those who are working the overnight shift, right, their shift is 1 hour shorter.
Yeah.
Of course, if you do the overnight shift in the fall, you do 1 hour longer. So we look forward to that, and that means, we're getting closer to, having longer days, longer sunlight days, which is great.
Still snow.
It is supposed to snow on Saturday during the parade. To those that are working here this weekend, now more than ever, we thank you for being with us here 24/7. And we'll be back again next week. All right, very good.
Great.
Thanks for being here, Al.
Thank you.
All right, very good. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.